Hey everyone, how you doing? My name is Dr. Lauren H. Collins and I am a pelvic health physical therapist. I wanted to come and talk today because I've been having this come up working with people, and it's just about issues with intercourse and infections that are happening. So I want to talk a little bit about sex hygiene. So forgive me because I took some notes down in a notebook so I can remember to cover everything. So the issues coming up with some of my patients and clients are issues like BV, so bacterial vaginosis, UTIs, urinary tract infections, and yeast infections. And so here are a few tips. One, for BV, if you are a person who is the receptive person during intercourse, have your partner wear a condom. Seminal fluid or semen changes our vaginal pH, which increases the amount of bacteria that cause that odor when we have that change in pH. So the first thing I'm gonna say is wear a condom. The second thing I'm gonna say is check with your doctor about using boric acid suppositories because that can help balance your pH. And boric acid, yes, like the boric acid you use to sprinkle around your house for pests. But you can use them in suppository form. The other thing I'm going to say is that if you do happen to have to go on an antibiotic for a BV infection, then that can sometimes lead to yeast infections. So keeping that in mind, you can always do things like decrease your sugar to help yeast-like sugar. So decrease your sugar intake, your white pastas, anything the carbs that can be converted into sugars, avoid those things, as well as, not wearing underwear when you're sleeping, because yeast likes, moist environments, moist, warm environments. So you can do things like that. And also, if you need to, you can see your doctor about getting a prescription for diflucan or an anti-yeast type of medicine. Okay, the next thing I'm going to say for UTIs, when you get done having sex or having your fun time, whatever you're doing, go pee. Peeing is one of the first things that helps to flush out the urethra, so that will help with decreasing the UTIs or urinary tract infections, especially if you're having a lot of sex. The other thing you can do is, if you have a bidet, great. If you don't have a bidet, you can use a squeegee bottle, like your regular water squeegee bottle. Use an old water bottle or any type of thing you can squeeze water out of. When you get done, just keep it in your bathroom. And so you get done with sex, you go pee, you fill the bottle up with a little bit of lukewarm water, and you just squeegee the area down, squeegee down your vulva afterwards to help kind of cleanse the area of any of the bacteria. I mean, it doesn't do anything like sterilize, but just flushes the area, right? Because during sex, some of the bacteria from your vagina and just through the act of having sex can get into the urethra. So you just want to flush everything clean. All right, so that's that for UTIs. The other thing I'm going to say is with sex, if you do anal play, the anal play should always come after vaginal play, whatever the vaginal play is. If it's receptive intercourse, if it's oral sex, whatever it is, you want the anal play to come after. What you don't want to do is have the bacteria from your anus going into your vagina if you do the vaginal play after the anal play. So the order it should go in should be vaginal play, then anal play. And if you decide to do it the other way around, then you need to wash up in between. That'll help as well with any types of infections. And then also, going back to infections, talk with your doctor too about prebiotics and probiotics. There's a lot of, research is coming up now about it. So talk to your doctor about that. And the last thing I'm going to say is after sex too, whether you're the receptive partner, make sure you're washing your hands, either partner. And I say that because a lot of times you have your hands in all the sex fluids, right? And then you go and you touch other parts of your body, you rub your eyes, you put your hands in, on your face, all those kind of things. So just make sure you're washing your hands when you get done having sex. Okay, so those are my tips to help with sex hygiene. Y'all have a good time, have fun, but to go ahead and make sure you're balancing your things out. These are just some small tips for you. Okay, have a good one. Happy New Year.